Okay, good morning, good afternoon, and certainly Andrew, good early morning to you. Welcome
Good morning,
everyone. Welcome everybody to the 26th MedResults Network Educational Webinar. I'm Jamie Parrott, Vice President and COO of MedResults Network, and as always, I just want to thank everyone for taking time out of your mornings and afternoons to attend our presentation today. In the last few months, we've done surveys of our members to find out exactly what they're looking to get out of our webinar presentations. And we asked what kind of topics you wanted to learn about, what kind of trainings you're interested in, and what would be most beneficial to you in your practice. And not surprisingly, our very first webinar of the year was with our partner Dermapen USA on acne and hypertrophic scarring, which you may remember. It was one of our most popular webinars ever. And following the presentation, our members continued to request more information on microneedling. So we decided what better than to hold another webinar with a world-renowned expert in microneedling. We have a very special webinar presentation today, not only for the fact that we've invited back Dermapen, but for the fact that we were able to get world-renowned international trainer and expert, Andrew Christie, to provide a high-level training on microneedling and the treatment's extensive range of modalities. As we have a ton of exciting information to cover today, I'm just going to dive right into the introduction of our guest speaker, Andrew. Andrew Christie, who you all can see here today, he's an Australian native, so ladies, get ready as you get to listen to his amazing accent for the next 45 minutes. And he's currently joining us from Perth, Australia, where it's about 2 a.m., so we feel extra privileged that you're joining us today, Andrew. You may remember that Andrew was just in the U.S. as he finished his first U.S. training tour in February and March. It was a major success. And fortunately, today's presentation with Andrew is really an introduction to the launch of his next U.S. training tour, as he's returning to lead a second round of microneedling training sessions this June and July. Andrew's appeared on TV and in dozens of interviews across the world as a master needler and an authority on clinical aesthetics. And as the global medical trainer for DermapenWorld, Andrew's the author of Advanced Innovations with Dermapen. And I think many of you received this just for attending our first webinar with Dermapen USA. So that's how you may be familiar with Andrew. He's also authored 3 other books on skin needling, and he's written hundreds of articles for industry publications and journals. So whether you're here today to get an intro to microneedling, to enhance your skills, or simply to learn new ways to incorporate this treatment into your practice, I'm confident that you're going to be impressed with Andrew's knowledge and you're going to want to learn more by the end of the presentation. So fortunately, Andrew's Advanced Summer Training Tour is available in over a dozen cities, and members who want to attend will receive a 10% discount off any of those training events simply for being a member in MedResults Network. So if you're interested in that training following the presentation, please let us know. And finally, before I begin, I want to remind you again, I always do this, that there is a 30-second survey that's going to pop up after the presentation with just a few questions to capture your feedback. If you have questions for Andrew or you're interested in learning more about Dermapen or Andrew's U.S. training tour, please use the survey to let us know. And with that said, I'd like to introduce Andrew Christie of DermapenWorld.
Good morning, everyone. I'm Andrew Christie. I do apologize for the accent. I'm the global medical trainer for DermapenWorld. Despite the fact that I'm currently in Australia, I'm based in Paris and I look after the clinical and medical education for all 60 of DermapenWorld's distributors internationally. With today's presentation, the aim is to really combine a lot of this information that I'm able to receive working with our distributors, working with our practitioners worldwide, and to take on board their unique protocols, to take on board their unique innovations so that we can create practicality, create profitability, but also create exciting times for working with your skin needling device. So through this presentation, I'm going to introduce you to some updated techniques, to invite you to have a look at some interesting protocols that will enable you to treat up and above over 57 indications with skin needling, both as an individual treatment, but to also combine that in with combination therapies as well. When I have a look at skin needling, I see this as a non-negotiable with any modern practice. I've specialized in this topic for the last 14 years of my career, and I remember first approaching audiences 14 years ago, and normally I would need to have spent the first 2 hours trying to convince practitioners exactly why they would want to be putting needles into their patient's face. Now, 14 years later, it's now a case of getting practitioners to cut the aggression, to cut being so traumatic on their patient's skin, and to utilize needling as a fast, effective, fractional rejuvenation for their patients. Quite simply, with skin needling, we have a very, very simple principle. I want you to think back to childhood, and you fell off your bike, or potentially you may have fallen off your horse. Now, with that, you would have had a graze on your knee or on your elbow. Your mother would have put a Band-Aid on your knee or elbow. 4 to 5 days later, you would take that Band-Aid off, and you'll notice the area which was damaged, which was traumatized, which was grazed. When you take that Band-Aid off, you'll notice that the skin is now whiter, it's pinker, softer, smoother, better texture, better tone. So quite simply, with the term I refer to as backyard science, we notice that the skin has a capability to reset, to reheal, to rejuvenate to an even better condition to what it was prior if it undergoes an experience of microtrauma. When we have a look at automated skin needling, what we are able to do is to ensure control with this microtrauma. So with automated skin needling devices, we can create with a set speed up to 1,296 controlled rejuvenating puncture channels per second into the skin. When I have a look at the 2 most commonly performed treatment in medical and also in clinical aesthetics, we have a couple of problems. The number 1 treatment for clinical aesthetics worldwide is microdermabrasion. The challenge that we see with this treatment is that it directly stimulates and directly targets corneocytes, or the dead skin cells that are sitting on stratum corneum. This therefore means that we don't have a direct stimulation of the cells which start to malfunction. For example, if you were to consider melanocytes, which will link in behind hyperpigmentation and hypopigmentation, or if you were to consider fibroblasts, which are our money makers or our anti-aging cells for the production of collagen, the production of elastin, and also the production of glycosaminoglycan or hyaluronic acid. The number 1 treatment performed in the medical arena is botulinum toxin injections. As an example, and hopefully this will work with the camera, you'll notice that when I move my hand, if I stop moving, my hand has wrinkles. Now, I'm a little bit self-conscious and wanted to make sure that I was looking as young and as youthful and vibrant as possible, especially for the 2 a.m. morning start this morning. So in my right hand here, I've put a very sneaky 48 units of botulinum toxin here. So you'll notice that my hand, I physically can't contract. So it's prevented this, but the challenge is as I hold my hand closer to the camera, you can still see wrinkles. So the misconceptions that we have with botulinum toxin is that it's able to treat, target skin integrity, and at the same time promote a correction of malfunction of the skin. The reality is it doesn't have that effect. So where skin needling becomes a non-negotiable for any modern practice is that this is the treatment that physically targets cellular malfunction within the skin. This is the treatment that allows a physical and direct stimulation of these cells to truly correct, to truly rebalance, to truly rejuvenate, and to also regenerate the skin, and to promote the skin to be in the best condition that it possibly can be. The reality is that the skin is a lot like the canvas that you see in a work of art. Now you can tighten that canvas, you can stretch it, you can pull that canvas, you can restore it, you can put a brand new gold frame around that canvas. But the reality is, if the canvas isn't a beautiful work of art in the first place, then no amount of stretching or pulling or a brand new gold frame is going to have any effect on the actual quality of the canvas. And this is where skin needling becomes a non-negotiable, a treatment that you must be, should be, want to be, have to be, will be, but non-negotiably working with, because this is the treatment that physically treats and targets and rejuvenates skin function and allows the skin to correct and to work as the best possible skin. The principles of this treatment are very simple. So as we have an understanding with microtrauma, there is no heat with automated skin needling. Likewise also because we have a very concentrated needle cartridge that is allowing anywhere, in some cases, up to 12 needles at 33 gauge to create the puncture channels. This means that there is no laceration on the skin. So this means that 100% of Fitzpatrick skin types are going to be suitable for this treatment. What it also means is, based on an understanding of skin physiology and cellular histology, that we can actually treat and target above and beyond over 57 indications. This therefore means that we don't risk the stimulation of profibrotic growth factors or the precursors to scar tissue by removing the heat. It also means by updating techniques with automated technology that again we minimize and remove the risk of laceration and provide fractional rejuvenation that enhances and still keeps the epidermis intact. Traditionally with skin needling, we've had an understanding since its development 30 years ago that needling works commonly for collagen induction therapy or for anti-aging. Needling also works for the revision of scar tissue, such as box scar, rolling scars, ice pick, even for treatment of post-chickenpox and netodermic, hypertrophic scars, keloids, and even contracture scars. We've also seen over the last 30 years that needling can successfully treat stretch marks. Now what I want to do is work above and beyond standard 30-year-old technology so that we can update your techniques, update your protocols, and as part of combination therapies, provide accelerated treatment programs so that your patients see faster results and you're also able to work with far more indications as well. The advantage of automated skin needling is that this is the next generation form of needling that develops above and beyond rolling technology. With this type of device, we have vertical entry into the skin. So with this vertical entry, this therefore means that all the needles are working at a 90-degree angle. With this 90-degree angle, this means that we can physically reduce the size of the needle, so we are just working with a 33 gauge. This creates a very clean entry. This creates a very clean exit within the skin. The automation means that we can actually change the speed. With this device that I'm holding now, at full speed, it enables 108 revolutions per second. With 12 needles, that enables 1,296 puncture channels a second to be made into the skin. So it creates the ultimate control for fractional rejuvenation. The other advantage that we see with this type of device is being able to change needle depths. With this device that I'm holding, we're able to work from 0.0 of a millimeter and then increase the needle depths right up to 2.5 millimeters, and that can be changed at any point, at any time during the procedure. One of the biggest challenges I've had as a needling practitioner are the emails that I receive on a daily basis saying, I have a patient, what depth should I be treating them on their skin? And it's the same answer that I write back to every question. I don't know. We have so many variables. Is the patient's skin thick? Is the patient's skin thin? Are you treating a forehead? Are you treating cheeks, nose, upper lip, chin? Are you treating a patient's neck? Are you treating their chest? Are you treating their back, their buttocks, their abdomen? We have so many different variables. Is it the first treatment with the patient? Is it their second, their third, their fourth? So when we have a look at the ingenuity of automated skin needling, the advantage is that any point throughout the treatment, you are able to change the speed or the oscillation. At any point throughout the treatment, you are able to change the needle depth so that you can truly customize that treatment for customized results for every patient, every indication, every time. This therefore means that we can work towards a visual endpoint. And by working with a visual endpoint, it means that we can change that depth as required, as appropriate, based on the treatment, based on the area of treatment, but also based on the indication that you're working with. The advantage that we see with an oscillation of up to 108 revolutions per second creates comfort. So essentially what the patient feels is a vibration on their skin. This vibration dissipates nerve receptors, which creates a far more comfortable treatment for the patient. So essentially, even if we're working a little bit deeper within the skin, what the patient feels is a vibration. The patient will feel a little bit of sharpness if we're working into the dermis and into the hypodermis, but the overall experience enables for fast, effective treatment. I actually treat with automated skin needling a full facial area in as fast as just 4 minutes. So quick, fast, effective strokes enables a quick, fast, effective treatment that is not only comfortable for the patient, but minimizes the trauma. The more you move this type of device, the more comfortable the treatment becomes and the more effective the fractional rejuvenation. With this needle cartridge here that simply pops out, we have 12 33 gauge needles. If I were to implement a stamping technique such as this stamping technique is only going to create 12 puncture channels. If I then start to move and glide this type of automated skin needling across the skin, you'll notice that I'm following in a horizontal direction. If I follow in a vertical direction and then diagonally, this is what's enabling the movement, and this is what's enabling the 1,296 puncture channels a second. As part of the treatment, we use a gliding medium of hyaluronic acid, which enables an easy, smooth move, but at the same time enables the mesotherapy infusion of treatment actives. If you're working with automated skin needling and you ever find that the device is dragging, we have a couple of considerations. The first reason that potentially this type of device could drag is that your needles are too deep for the area that you're working on. Secondly, you may have a very, very low speed. So just because we can reduce the speed, bear in mind that this also reduces the amount of puncture channels that are created through treatment. So I recommend for 90% of cases, top speed with an automated needling device. The third reason why you may experience drag is quite simply there's not enough treatment medium to enable that smooth and effective glide across the skin. The advantage that we see with automated skin needling is that the combination of additional therapies and modalities can start to accelerate results, can start to reduce the number of treatments that are required. So again, we start to see fast, effective treatment plans. With fast, effective treatment plans, we secure the patient or secure the client to the business, but we also guarantee that repeat and ongoing business because the patient is seeing such fast, dramatic results. This leads us on to profitability. With previous needling technologies, we notice that there is a lot of reliance on topical local anesthetic. If you're working with certain mass market brands, in some cases this topical local anesthetic may take anywhere from 45 minutes up to 1 hour to process. This doesn't work profitably. For those of you who are working with laser technology, working with IPL technology, let's consider the process of hair removal, for example, the Brazilian area. It would normally take anywhere from, say, 6 minutes to about 15 minutes for that treatment to be undertaken. With that treatment, you wouldn't be using a topical local anesthetic. Realistically, when we have a look at modern automated skin needling, with a treatment that can be performed in as little as 4 minutes, with a treatment that's fast, with a treatment that allows that automation to create comfort and to create effective and long-lasting treatment for our patients, we don't need to be so reliant on topical local anesthetic. The patient feels a vibration. The patient will indeed feel some sharpness, but for a treatment that can be performed in as little as 4 minutes, we have a fast, effective treatment that enables profitability. By combining this with combination therapies, each of these combination therapies that we add into allow further increased profit with allowing full treatments in as little as 20 minutes. This therefore means that with the dermapen treatment and combination therapies, including mesotherapy gliding mediums, working with PRP, working with chemical peels, but even working with LED light technology, this means that you may be able to treat up to 2 to 3 patients an hour and be able to charge $600, $700, $800 plus for the experience. What the patient experiences is a mild to a moderate sunburn, both in appearance but also in sensation, for 1 to 2 days following the procedure. With automated skin needling, the patient should never be experiencing grazing, never be experiencing track marks, and never be experiencing any bruising. The ingenuity that we see with automated skin needling, you will see on the screen that there is a demonstration or an image of a roller. Unfortunately, with rolling technology, as the needles enter the skin, they will enter at a 90-degree angle. But as the physical mechanism of that roller moves around, it means that the needles are going to leave at a 45-degree angle. This is going to increase the risk of laceration and tearing of the skin. As we start to develop this level of trauma, then the risk of this is to stimulate the risk of profibrotic growth factors or the precursors to scar tissue. What this also means is we have a significant increase in the risk of post-inflammatory hyperpigmentation. This therefore reduces the number of patients that you would be able to work with. With automated skin needling, you will be able to work with the fairest Fitzpatrick 1 skin with no risk. You will also be able to work with the darkest Fitzpatrick 6 skin with absolutely no risk as well. So what we are doing is updating this technology to make it more practical for the practitioner, but to also make the treatment experience far more comfortable for the patient. By adding in our combination therapies, we can then start to accelerate the treatment programs. The challenge that we see with modern skin needling is so much technology is reliant on 30-year-old needling technology. We've known for the last 30 years that needling works effortlessly for the reduction of scar tissue, such as post-acne rolling, such as box scar, ice pick, and epidermic scars following chickenpox, hypertrophic scars, and also keloid scars. We've known for the last 30 years that needling works effortlessly for collagen induction therapy or for anti-aging. We also have known for this time period that needling works for stretch marks. Challenges that we see if you were to Google in skin needling is that we see images of celebrities, we see images of patients with incredibly bloody faces. Quite simply, for those of you who are working as needling practitioners, if you have a mop and bucket to mop up the blood after the treatment, then perhaps we need to update your technique and perhaps we need to update your thought process with skin needling. A lot of modern practitioners are still reliant on 30-year-old technology, which says the more blood is the better. The challenges that we see is more blood equals more significant downtime. As we start to increase that level of trauma, we go against the initial principles of skin needling to introduce fractional microchannels into the skin. We also go against the initial principles to have a fast, effective healing response. As I previously mentioned, there should never be any grazing, there should never be any scabbing, there should also never be any bruising with this type of treatment. So as we have a look at these perceived restrictions, the other challenges that we see with this 30-year-old technology is that the process is going to be incredibly painful for the patient. The patient expects significant downtime, anywhere of 2 weeks and beyond, and the patient also believes that the treatment, especially when we see celebrities on the internet or Google, that it's going to be a very, very expensive treatment for them. By updating 30-year-old practices, by updating our techniques, rather than looking at marketing, rather than having a look at protocols that simply say, needle your patient every day, needle your patient every week, the skin is what actually provides us with the answer. Having a look at the skin's physiology, having a look at cellular histology enables us to have an understanding of what creates direct cell stimulation, an understanding of where we should be working in the skin depending on the indication that we are wanting to treat, but also enables us to have a better understanding on how to design an effective treatment program that works in for every patient, for every indication, for every treatment, for every time. And this is about becoming skinnovative. As we have a look at this process of becoming skinnovative, it's about understanding how the skin is working, where our cells are sitting, the difference between our layers, but understanding the difference between what is direct cell stimulation as opposed to going through those cells and creating indirect cell stimulation. As we see from our very basic drawing on the PowerPoint, we have a rudimentary image of how the skin should be looking. With the skin, we have 3 layers. The base layer is the hypodermis, otherwise known as subcutaneous. The next layer up is the dermis. The layer above that is the epidermis. In the hypodermis, we don't have any sublayers. However, in the hypodermis, the primary cell group are adipocytes or fat cells. When I have a look at dated needling technology, we're directly targeting these adipocytes. The fact that we have large vascular activity within the hypodermis and bloody treatments means that we're working too deep within the skin. If I were to consider the next layer up, or the dermis, because of the presence of fibroblasts, this essentially is the moneymaker layer if you want collagen induction therapy. If you're wanting to treat and revise the appearance of scar tissue on the skin, but also for treatment of stretch marks. The dermis itself is divided into 2 layers. We have papillary dermis up the top, and then reticular dermis underneath. There's 3 major cell groups that appear within the dermis. The primary cell group are fibroblasts. Fibroblasts are what are responsible for collagen production, also for elastin, and also for glycosaminoglycan or hyaluronic acid. From a collagen induction therapy perspective, fibroblasts are the cell that you need to be, should be, want to be non-negotiably directly targeting if you do indeed want collagen induction therapy. So we have an understanding that if we have exceptionally bloody treatments, your device is working directly targeting adipocytes within the hypodermis as opposed to fibroblasts that are appearing in the dermis. The second most dominant cell that you will find in the dermis are macrophage cells. Macrophage cells enables the process of phagocytosis, where the cells are able to move through a permeable vessel wall and to kickstart the process of repair to enable regeneration and rejuvenation. Quite simply, the better the quality of the skin, the better the immunity, the better the systemic health of patients, then the faster, the more effective the repair response is enabled as part of an automated skin needling treatment. The third dominant cell group that we have in the dermis are again some adipocytes, but because the primary cell group are fibroblasts, this needs to be the layer that you want to treat for anti-aging, for scar tissue, and also for stria. We'll note that there's also vascular activity that occurs in the dermis. By contrast to what we see in the hypodermis, the vascular activity which is concentrated around papillary dermis, the vessels are more frequent, but the vessels are also smaller. So when we also have a look at this area, because of the presence of this vascular activity, it would also make sense that this would be a suitable area to treat for imbalances of vascular activity, including telangiectasia, including rosacea, such as erythema telangiectatic, such as papulopustular, but even treatment of phymatous rosacea. The next layer up is the epidermis. With the epidermis, traditional 30-year-old needling technology questions, why would you want to treat so superficially? Well, the reality is, as we start to break through the layers, as we start to have a look at the 5 major cell groups, we see that this indeed is the perfect layer to treat and to directly target for signs of acne, for signs of hyperpigmentation, but also signs of hypopigmentation. The base layer of the epidermis is basal, followed by spinosum, then granulosum. The layer above granulosum is known as stratum lucidum. Stratum lucidum you will find on everyone, on the palms, but also on the soles of the feet. We also find that there is a specific demographic of a Fitzpatrick 6 Northern African skin, which also has a stratum lucidum all over the entire body. The top layer is the stratum corneum. When we have a look at the 5 major cell groups that exist within the epidermis, this enables us and inspires us to start treating more superficially with an automated skin needling device. Accounting for 90 to 95% of cells within this epidermis are keratinocytes. The process of keratinization enables renewal, enables and promotes desquamation, but also enables a compact dermis. If you see issues where the skin is undergoing congestion, or a term referred to technically as retention hyperkeratosis, if we see acne, if we see milia, keratosis pilaris, these are all signs that the process of keratinization is not being optimized or working as effectively as what it should be. A fully keratinized keratinocyte is known as a corneocyte, and a corneocyte is what coats the very top layer of stratum corneum. The third cell within the epidermis are melanocytes. The melanocytes exist and live in the stratum basal, the base layer. However, the melanocytes are able to transfer a pigment capsule known as a melanosome, and this occurs in the next layer up in spinosum. So it would make sense that if we are wishing to treat any imbalance of pigmentation, including hyperpigmentation, but also hypopigmentation, then it would make sense to work more superficially. So rather than drawing blood from the dermis, rather than drawing significant blood from the hypodermis, we are able to directly treat and target these melanocytes and the exchange of the pigment into the keratinocyte between basal layer and spinosum. This enables treatment for melasma, treatment for ephelides or freckles, and treatment for age spots such as lentigines. But this also enables treatment for chemical leukoderma, post-inflammatory hypopigmentation, and even treatment as part of combination therapies for vitiligo. From keratinocytes to corneocytes to melanocytes, our remaining two cells that we have within the epidermis are Langerhans cells. A Langerhans cell is a dendritic immune cell that exists around the spinosum and granulosum layers. Again, this enables protection, this enables increased immunity, but also defense for the epidermis and its integrity. The final cell that we see is known as a Merkel cell. And a Merkel cell is touch sensory, so it will register vibration, it will register sensation, but as opposed to a free nerve ending, as opposed to a myoclonic corpuscle, for example, these nerve cells are sitting significantly lower within the skin. So these are actually sitting through the dermal layer. So therefore, as we start to work from around papillary dermis upwards, we are able to treat without being reliant on a topical local anesthetic. Our Merkel cell will still register vibration, it will still register sensation, but with fast effective treatment at 108 revolutions per second, it enables treatment comfort where the skin is not registering intense sharpness or intense pain. With traditional 30-year-old skin needling technology, the treatments have always been about drawing a lot of blood. But we now have an understanding that by treating and working more superficially, but also directing our needling device into the dermis, into the hypodermis, that we can treat visually. With this, if you were to treat directly into someone's hypodermis, your visual endpoint is lots of blood. If you were to treat into someone's dermis, which would be the layer to treat and target rosacea, to treat and target anti-aging and scar tissue, your visual endpoint will be pinpoint bleeding. Your visual endpoint for directly treating into the epidermis is going to be an inflammatory response. So the classic signs of some redness, the classic signs of some swelling, but we're not going to see any blood. So by treating visually as opposed to mathematically, I can now work with my skin needling device for a very concentrated, for a localized treatment that is customized for my patient's indications, but also customized to directly target the right cell at the right depth, for the right response, for the right treatment, and the right results every single time. So quite simply, to working with the dermis, there's no blood, an inflammatory response, the epidermis. Treating into the dermis, you will see pinpoint bleeding, and then treating into the hypodermis, your endpoint is going to enable lots of blood. So this really enables us to have an understanding based on the cells, based on the layers, as to what exactly I can treat with automated skin needling. The only time you would want to treat into the hypodermis, ideally, is for treatment of white stretch marks or striae, or for treatment of white hypertrophic scars. You can also treat cellulite through this area here. For the dermis, this would be the area that you would treat for collagen induction therapy or anti-aging, the area that you would treat for all forms of scar tissue, such as post-acne rolling, box scar, ice pick, anatodermic scars following chickenpox, hypertrophic scars, and even keloid or contracture scars. This would be the area that you treat for a malfunction of vascular activity, such as telangiectasia, also including rosacea, including forms such as erythema-telangiectatic rosacea, phymatous rosacea, and even papulopustular rosacea. Working in more superficially into the epidermis, we are able to treat malfunctions of keratinization. This includes milia, this includes keratosis pilaris, but this also includes treatment of acne. This would also enable treatment for comedonal acne, papulopustular acne, and also nodular cystic, so up to a stage 3. Through the epidermis, you can also treat to directly treat and target melanocytes and the exchange of that pigment to enable effective treatment for post-inflammatory hyperpigmentation, treatment of melasma, lentigines, and even treatment of ephylidase or freckles. Likewise, we can also treat an imbalance where we see hypopigmentation, so that enables treatment of chemical leukoderma, post-inflammatory hypopigmentation, and even vitiligo, predominantly the forms of acral and generalized. Moving back down to the dermis, because of the blood flow, this is where you would also treat issues including alopecia. So that would be alopecia areata, tractional alopecia, cicatricial alopecia, and also as part of combination therapies, you can work with androgenetic alopecia as well. So by working with a visual endpoint, I have a clear understanding of exactly where my needles are working for every patient, for every indication, every session, every time. What we need to determine is now how often I needle. Do I needle my patient every week? Do I needle my patient every 2 weeks? Every month? Having a look at the biological responses, the first is the inflammatory response. So with the inflammatory response, I feel pain, I feel heat, there's redness, there's swelling, and there's loss of function, but you'll notice there's no blood with this. 2 key steps of the inflammatory response when we're not drawing blood is the process of phagocytosis, where we're creating a permeable vessel wall which enables the white blood cells to move up and out. Your endpoint in many cases is going to be leukocytes, which will appear as pus on the surface of the skin. What we also see as a successful part of an inflammatory response for the skin are the release of growth factors. Whilst there are a couple of 100,000 of growth factors potentially I could go through, these regulatory growth factors enable balance, they enable regulation to direct and to guide and to enable effective skin function and skin behavior. Some key growth factors to consider that are released as part of the inflammatory response. Within the epidermis, the key growth factor that manages this layer is known as epidermal growth factor. Keratinocyte growth factor then enables management of the process of keratinization. So if your patient is experiencing signs of acne, milia, keratosis pilaris, then indeed we do have a malfunction of the skin zone process to turn these cells over faster and more effectively. So the role of regulatory growth factors can reinstate correct cellular renewal and desquamation. Growth factor that we also see within the epidermis is melanocyte growth factor. And this melanocyte growth factor is able to manage and balance what's too much pigment, so hyperpigmentation, but also what's not enough pigmentation. So by working more superficially, we promote this inflammatory response without drawing blood on the skin, but we are able to maximize regulatory growth factor release. The acute inflammatory response is resolved in a couple of days. Chronic inflammation is resolved in a 2-week time period. So if we achieve resolution within this therefore means biologically we can actually directly treat the skin without drawing blood as often as every 2 weeks. So for treatment with automated skin needling to target hyperpigmentation, every 2 weeks. For treatment of acne, treat the skin every 2 weeks. And likewise for milia, and likewise also for treatment of keratosis pilaris. However, if we're going to draw blood, we move on to the next stage of the skin's wound healing response, and this is known as proliferation. Proliferation will occur when blood is drawn. The first step of proliferation is angiogenesis, or the release and development of new capillary networks. The second but key step of the proliferative response is collagen deposition. by creating a microtrauma with an automated skin needling device. This enables a collagen deposition that is regulated, that enables effective and scarless wound healing. This enables fractional regeneration that does not over-traumatize, that does not rip, that does not tear, but does not burn the skin. Biologically, we have a release of immature type 3 collagen, which is able to swim up the punctured channels that are created by the automated skin needling device. Over a 6 to an 8 week time period, this immature collagen then develops and transitions into structurally sound type 1 collagen. With this process, because it transitions over a 6 to an 8 week time period, this therefore means that if you're going to draw blood with an automated skin needling device, the biological process states treat every 6 to 8 weeks. If your patient is under the age of 35, this will probably allow for treatment more towards the 6 week mark. If your patient is over the age of 35, then you may be able to treat as often as every 8 weeks. What we wish to do is to reduce and to prevent multiple wound healing responsibles. If we create simultaneous wound healing response, the risk is the stimulation of profibrotic scar tissue, and the risk is increased trauma, which may present as post-inflammatory hyperpigmentation. I want you to imagine a movie set in Los Angeles. If we were to have 3 directors directing and treating the one set, the one cast, the one crew, and the one script, we're going to create chaos. However, if we have one director that is able to direct and guide that single set, cast, crew, and script, then we create regulation, we create balance, and we remove that risk of chaos. This therefore means that by simply alternating treatment depths with your automated needling device, we can treat as often as every 2 weeks, but by altering our depths, we are able to draw blood when we start off, and this will enable collagen deposition when this blood is drawn. We can treat 4 weeks later, more superficially, 4 weeks later, drawing blood. 4 weeks later, superficial, no blood. So by alternating our treatment plans, every time blood is drawn, we promote angiogenesis and collagen deposition, but then by treating 2 to 4 weeks later, we then promote the release of growth factors. So ideally with patients, we could treat by drawing blood, then 2 weeks later, no blood. 2 weeks later, again, no blood, and for an 8 week program, another 2 weeks, no blood. Then another 2 weeks, we can then perform with blood again. So this enables a process, a treatment program that works in with the skin's own biological functions to promote efficacy, but to also promote duty of care for our patients. So by treating more superficially, we are now able to work with an automated skin needling device that enables treatment of hyperpigmentation, treatment of acne, treatment of milia, treatment also of keratosis pilaris. We also understand that by treating more superficially and stimulating an inflammatory response as opposed to a proliferative wound healing response, we are able to reduce our treatment intervals and see our patient as often as every 2 weeks. By customizing our treatment programs, for example, if I were to consider a patient who's aged, such as the patient that we see on the screen now, we would be able to treat as often as every 2 to 4 weeks. By alternating our treatment depths, by drawing blood, we then create the stimulation of collagen and angiogenesis, and then 2 weeks later we could treat with no blood to treat and target the pigment. And then again, 2 weeks later, 2 weeks later, then 2 weeks later, blood. So by alternating our depths, we enable a safe and effective treatment program. This also enables limitless indications that you can now treat with automated skin needling. Traditional 30-year-old skin needling technology says that we can work with collagen induction therapy or anti-aging, says that we can treat scar tissue and also work in with striae. But as we can see with these innovative and modern techniques, that we can now treat limitless indications. The last time I sat down to actually list these indications, I stopped writing at 57 indications. So we can treat erythema telangiectatic rosacea, we can treat tractional alopecia, we can treat melasma, we can treat nodular cystic acne, in addition to our more traditional indications such as scar tissue, stretch marks, and anti-aging. With the automated component of skin needling, we are able to therefore assess and remove the risk of or the use of topical local anesthetic. So quite simply, the vibration that the patient feels enables rapid treatment comfort that dissipates nerve receptors. So as opposed to previous needling technology, such as rollers, this therefore means that the patient experiences a much happier treatment. This therefore means that we can work in as fast as 4 minutes for a full face, and then in combination with combination therapies, we're able to combine these and have a treatment that's performed in as little as 20 minutes. Without being so reliant on the use of topical local anesthetic, the patient's experience is positive, but also you are able to see as many as 2 to 3 patients an hour. So quite simply, by also innovating our techniques, by working fast across the skin, fast strokes are going to enable for us fast and effective treatment. As opposed to stamping, if we hold this device in the one spot, it will only create 12 holes. If I move it, we then see 1,296 puncture channels per second. So this enables fast and effective treatment where the patient sees faster results, where we can increase our indications, but also see our patient more often. By also removing the reliance on topical local anesthetic, this also means that we create a far more profitable treatment. So in many instances, many practitioners will find that their skin needling treatment, their skin needling device delivers them the highest profitability, even by comparison to laser, to IPL, to injectables, and traditional treatments such as microdermabrasion and also chemical peels. When we have a look at the role of combination therapies, the addition of this with our device that creates automated skin needling enables faster treatment plans. We see an image that shows the infusion of PRP into the skin. So what we see on the top image is the infusions of the green liquid, so the water-based solution that is able to absorb through the puncture channels. We see with the second image that we see a complete spread of this water-based solution within the dermis. So the combination of mesotherapy solutions with products such as hyaluronic acid, the combination of solutions such as PRP enables a spread within the dermis but an effective infusion. By comparison to inject technique, especially with PRP, where the patient may need to undergo anywhere from 600 to 1,200 individual injections to infuse and to inject that PRP, what we're now able to do is to either combine our technologies or work with our device to infuse that water-based solution into the skin. This enables effective spread. We can also combine in the use of chemical peels in with a skin needling procedure. By working with a keratolytic or a very superficial chemical peel, for example, such as lactic acid in a very light percentage, we are able to apply this over the top of a freshly needled skin to enable a tyrosinase inhibiting response, but to also enable a more rapid resurfacing. Our aim is to renew cells that are affected by hyperpigmentation. We can also work in with a very mild salicylic or oil-soluble peeling agent that is able to also promote faster and more rapid keratinization. So the use of these very superficial chemical peeling agents are designed to enhance the treatment without burning the skin. Working with deeper chemical peels, such as trichloroacetic acid or even a Jessner peel, we can implement this for treatments and combine this for a combination therapy for reduction of scar tissue. Rather than using Gore's method, we can actually work with a toothpick. And so simply by dipping this toothpick into peeling solution following an automated skin needling procedure and applying that to the individual divot where we see a boxcar scar, where we also see an ice pick scar or even post-acne rolling scars, enables a concentrated and a localized treatment. So quite simply, by increasing the level of trauma slightly by establishing coagulative necrosis through combination of toothpick application onto areas of atrophic or depressed scar tissue, we are able to increase the collagen response to fill the area of atrophy and to also enable less treatments so that the patient sees faster results for the reduction of their scar tissue. The combination of steroid injections enables a safe and effective treatment plan for the treatment of keloid scars. Keloid scars are a phenomenon in Fitzpatrick 5 and 6 skins, but also a phenomenon of Nordic Fitzpatrick 1 skins. So the injection of a steroid solution directly into the keloid prior to treatment reduces the release of growth factors and subsequently the proliferation of collagen. We can also work in with topical antimitotics. The application of these antimitotics enable treatment to further prevent cellular proliferation and differentiation to flatten out scar tissue. So in combination with steroids, we can actually treat keloid scars. We can also flatten out hypertrophic scars in as little as 2 to 3 treatments. We also see some innovative techniques by using specific antimitotic drugs that enable a control to resurrect suicided or destroyed melanocytes to even enable treatment for acral and also for generalized vitiligo. The combination of cryotherapy or using nitrous oxide cryotherapy enables treatment versatility for stretch marks, treatment versatility applied following an automated skin needling procedure that will work for deep wrinkles, but again, similarly to chemical peels, to enable the filling of atrophic scar tissue, such as rolling scars, such as boxcar scars, and also ice pick scars as well. We also see effective combination therapies with automated skin needling by using light therapies, particularly low-level laser and also LED. When we have a look at this therapy, the effect of LED works to promote collagen regeneration, but also reduces inflammation. So therefore with this serves as a suitable treatment program to prep and prime the skin prior to an automated skin needling treatment. The risk that we create by applying a regenerating LED immediately following an automated skin needling procedure means that it will reduce the inflammatory response far too quick. By reducing the inflammatory response, this therefore makes many of our treatments void and ineffective. But applying this type of technology prior enables a preparation to prime and to maximize the collagen response and collagen regeneration as well. Having a look at some successful stories and before and after images. We see a first patient with glycation. We see a female patient here also with accelerated signs of aging and also deep wrinkles and pigmentary imbalances. This is just 4 treatments. The second patient, what we see is a change in facultative or uneven skin tone as well as wrinkle depth in just 2 treatments. The third patient, we see that we can treat using automated skin needling not only underneath the eye area, but also around the tear trough, as well as on the actual eyelids, and even through the eyebrows to target brabatosis. As we can see from our before and after images here, we can treat even darker Fitzpatricks. The first patient has a mesotherapy cocktail of kojic acid, vitamin C, and hyaluronic acid that's been infused into the skin. So what we see immediately, even after 1 treatment, is a clarity and a radiance. The second patient is just 1 treatment, and this is a combination therapy where a very mild lactic acid and a very mild salicylic acid solution has been applied immediately following an automated skin needling procedure. We see a fast, effective, rapid reduction in pigmentation, but also rejuvenation. The after image was taken just 1 week from the before image. We see with the third before and after image that we can even treat and control in combination with topical product melasma to enable control, to enable stability, but a reduction of this pigmentation that appears bilaterally on the face. In conjunction with antimitotics, we are able to see this combination therapy enables the repigmentation of hypopigmented lesions, including chemical leukoderma, including post-inflammatory hypopigmentation, and in the case of these patients here, in as little as 3 treatments, we start to see the resurrection and the migration of melanocytes for acral, and also for generalized vitiligo as well. For treatment of telangiectasia, for treatment of erythema-to-telangiectatic rosacea, papulopustular rosacea, and even phymatous rosacea, we see effectiveness to control vascular irregularity, but to also simultaneously, with an automated skin needling device, promote redensification and revolumization of the dermis and also of the epidermis. As we can see from the before and after images, we can treat leg spider veins or telangiectasia. From the second image, we can start to reduce the thickening associated with phymatous rosacea. But as we also see from the third image, we can promote increased skin volume. What we can also promote is a rejuvenated skin with reduced telangiectasia and increased density and strength. We can also work with automated skin needling more superficially to treat the signs of acne, from comedonal acne to papulopustular and even nodular cystic acne. By promoting regulatory growth factors, we enable the skin to extrude congestion and enable the skin to remove clogging for the removal of acne, the removal of milia, and also keratosis pilaris. The first patient is immediately following treatment where we've applied a very light salicylic acid peel immediately following an automated needling procedure. The second patient is complete resolution in just 6 weeks of stage 2 acne, working superficially. We now see the resulting rolling scars, and now we can create a treatment program that works deeper. The third patient, we see the complete removal of comedones after just 2 treatments by promoting the skin's own desquamation process and activating and supporting keratinization. For treatment of scar tissue, effective treatment programs and combination therapies enable the treatment of rolling scars, the treatment of box scar and ice pick scars. We can see that combination therapies, even working with chemical peels, working with cryotherapy, enable an acceleration of results. So patients will see their results in as little as 2 to 4 treatments, as opposed to 6 treatments, 8 treatments, 10 treatments. We are able to treat hypertrophic scars with our third before and after image, and even post-chickenpox and netodermic scars. With both these patients, you'll notice that they're a little bit younger, and so with this, we can treat at closer treatment intervals due to their collagen reaction. Combination therapies using steroid injections and also using antimitotics enable treatment of hypertrophic scars, but for our second image, we can also see that just by applying coagulative necrosis or 35% TCA peel, just with a toothpick, we can reduce the number of treatments required just by increasing that level of collagen deposition and also the creation of a stronger and more resilient extracellular matrix. Treatment of stretch marks provides dramatic reformation of tears within dermal connective tissue. As we can see, combination therapies can start to accelerate fast and rapid treatment programs with visual results after just 1 treatment. Combination therapies by using chemical peels, combination therapies also by incorporating cryotherapy enable an even faster treatment plan, particularly for white stretch marks which are sitting lower within the skin. Treatment of alopecia works as part of combination therapy with PRP and also with the infusion of topical drugs that can be applied to infuse within the puncture channels that are created following an automated skin needling procedure. Depending on the form of alopecia, there are specific protocols to treat cicatricial alopecia, tractional alopecia, alopecia areata, and also androgenetic alopecia as well. When we have a look at the world leader and also the developer of automated skin needling technology, Dermapen 3 is the creator. Dermapen 3 was developed in 2010 by an Australian company and is now distributed in over 60 nations worldwide. We have a medically engineered and developed product that works with a single, sterile, single-use individual needle cartridge which contains 12 33 gauge needles. With the Dermapen 3 device, it enables treatment depth from 0.0 of a millimeter right up to 2.5 millimeters. We can also change speed increments at full speed that enables 108 revolutions per second. This enables 1,296 puncture channels to be created into the skin. The ergonomic pen device enables treatment anywhere on the face, anywhere on the body, and enables the simple adjustment of speed and needle depth at any point throughout the procedure. This enables targeted, localized, and direct treatment that enables treatment of over 57 indications to enable accelerated, comfortable, but also dramatic treatment results for our patients. I thank you so much for your time this morning, and I look forward to catching up with you, hopefully, during my tour of the US and Canada, and I look forward to your questions and also look forward to sharing further innovative treatment plans, protocols, and indications with you in the future. Thank you so much for your time.
Andrew, thank you so much for your presentation. That was a wealth of knowledge, and delighted that all of you decided to stay on for all the information. It certainly was educational for me. For everyone who has questions for Andrew, and I did see a few hands that came up during the webinar. I'm assuming you have good questions for Andrew. Please use the survey that will pop up after this presentation to reach out and let us know that you'd like to speak with Andrew, you'd like to get a question answered, or, as I mentioned at the beginning of the presentation, Andrew's webinar presentation today was really an introduction to the launch of his U.S. training tour, which will be held throughout June and July. And I can tell you right now that he's going to be going everywhere from New York to Boston to Atlanta, down to Fort Lauderdale, to Dallas, to Vegas. He has several locations across Southern California, LA, Irvine, in San Diego, and he'll be all the way up to Vancouver, Chicago, Columbus, you name it. So if you're in one of those areas and you'd like to attend one of Andrew's training courses, there's an introductory course, an advanced training course, and a dermatological master class, and all of our members receive 10% off of each of those events. So please use the survey to let us know if you're interested, or contact me directly. Once again, thank you for your time. Thank you, Andrew, for being so fantastic and for getting up so early for this great event. I look forward to having you all on our next webinar presentation. Thank you again. Bye-bye.
Perfect. Thank you.